complications that can come from having these blood clots in the veins?
Well, the complications can be very dire and very severe. Now, the main problem with a deep venous thrombosis is that blood clot may travel.
Okay.
It can be dislodged from the leg and it can travel to the lungs. And if it travels to the lungs, then it can produce what we call a pulmonary embolus. Now, depending on the size of the pulmonary embolus, it could be even fatal. If the blood clot is large enough and it occludes the blood vessels going to the lungs, then your blood does not get oxygen from the lungs, and therefore it could be a fatal pulmonary embolism. Now, thankfully, most of the time they are not fatal and they can be treated quickly. But the whole idea is to catch this before it travels,
Absolutely.
when it's still in the leg level, if the deep venous thrombosis, if you want. And the treatment would be anticoagulants, of course, blood thinners, and we have so many of them nowadays, and we have so many modern ones that really makes the treatment so much easier. It used to be a very complicated treatment requiring intravenous blood thinners, like would be heparin, or injected blood thinners like Lovenox. And then we had to deal with Coumadin, which can have many problems in terms of follow-up, in terms of monitoring, in terms of diet that the patient needs to keep when you're taking Coumadin. But we have many modern ones now. For instance, you will see them on TV all the time. Pradaxa, Xarelto, and Eliquis would be the three main ones that we have nowadays, where monitoring is minimal, and they're really, really effective with very little bleeding. And they have really, I have no stock in any of these companies, but they are really revolutionized the treatment of clotting problems and has made it so much easier to treat these patients.